One of the most underappreciated elements of a surgeon's life and one of the most important non-technical skills that we can develop is leadership. How do you be the best possible leader, both inside and outside the operating room? Well, Dr. Varun Kapila has thought a lot about this question, and he's written a book about it. Dr. Kapila is a vascular surgeon in Brampton, Ontario, and has held many leadership roles both at the local, provincial, and national level. Dr. Kapila wrote a book which is called 6 Lessons for Everyday Leadership. From the operating room into everyday life, what surgery taught me about leadership that can be applied by everyone. And really, this book is not just for surgeons or surgical trainees. This is a book for everyone and translates many of the lessons that Dr. Kapila has picked up from being a surgeon and how he applies them both to his personal and professional life. On this week's episode, we caught up with Dr. Kapila to talk about his thoughts on leadership, how he became interested in leadership, whether leadership can be taught or whether it's innate, and really to delve deep into his book. Make sure to check out his book and buy the book and have a read through it. It is very quick and easy read. I promise you'll enjoy reading the book. And we would love to hear your thoughts. What skills in terms of leadership should we be teaching surgical trainees in the 21st century? Send us an email at podcast.cjs@gmail.com.
Welcome to the Cold Steel Surgical Podcast with your hosts Amir Farouk and Chad Ball.
Dr. Kapila, thank you so much for joining us today on the Cold Steel Podcast. It's an absolute pleasure and an honor to have you on the show to talk with a fellow surgeon, an author, and truly a leader. So again, thank you for taking the time to spend with us talking about your book and all the work that you've done.
Thank you so much. It's a great privilege to be here and love the podcast. And thank you for the work that you're doing in this space.
Can you tell us a little bit about where you grew up and where you did your training?
Yeah, I grew up in Markham, Ontario, born and raised. Got the opportunity to meet my future wife in high school. We actually went to medical school together. But prior to that, I did my undergraduate degree in physiology and biochemistry at the University of Western Ontario, and then went to the University of Ottawa for medicine, and then ultimately to the University of Toronto for general surgery, followed by 2 years of vascular fellowship.
So that's such a lovely story about you. So you and your wife were high school sweethearts then.
Yeah, I like to think high school sweethearts. She reminds me that we only started dating at the end of high school, but it was at that point that we realized that there was something special there. She went away to a different university. I went to Western, and then we actually couples matched and went into medicine together in Ottawa and couples matched at the University of Toronto later on.
You know, it's funny, in preparation for this interview, I actually found an interview that you had done as a resident while you were in Toronto, talking about the fact that that sometimes older patients have difficulty placing trust in people that they think look young. And I thought that just must have said something about the way that you looked and the way you still look so young during residency, that people were thinking, oh, this guy's not old enough to be my surgeon.
Yeah, all the time. Like you would come across, and the first thing people would ask is like, "You're a little too young to be a surgeon, aren't you?" And even today, I guess that's kind of a blessing and a curse at the same time. But sometimes looks can be deceiving.
So you work in Brampton currently, is that correct?
Correct. Yeah.
What does your practice look like currently?
So it's changed over the years. Like when I first started, like most surgeons, I was in the clinical trenches every day, doing a lot of call, a lot of operating. And over the past few years, there's been a switch towards that leadership lens that I sort of talk about, that we're going to be talking about today. So now it's about 50% clinical, and 50% of my time is to leadership pursuits, where I do work on the provincial level in various different aspects, which I find equally rewarding.
So, and can I ask, how many years into practice are you now?
About 15.
And we'll obviously talk about what drew you into leadership, but how, what was sort of the evolution in terms of you being very clinically heavy, and I can imagine, your hospital in Brampton must be extraordinarily busy with extraordinary volumes. And it's very easy to kind of get lost in that. And you and I obviously share this passion for surgery, and you feel this immense, this tangible benefit that you get from every patient that you operate on, every patient that walks away with revascularized legs. Like that's something that you can put a Doppler on and hear a signal, right? But so how did that transition happen from you being a clinically extremely heavily busy surgeon to getting more into the leadership and academic or administrative type roles?
Yeah, and I think, when I speak with surgeons, I feel like most people have this relatively same trajectory. The first 1 to 5 years, you are not confident enough to be able to do everything, but you feel confident enough that you want to do everything. And there's that internal struggle. And after 5 years, you get to a point around that, I think, in most people's career, where you feel like I'm comfortable and I want to do something else niche like. And that usually is still within the surgical domain. So for me, that was trying to do a little bit more endovascular intervention, some more complex care that previously wasn't available. And then around the 10-year mark, which happened to coincide with the pandemic, something changed. And I think for many people, it opened our eyes into what was working, but more importantly, what wasn't working in our healthcare system. And how could we, being the clinical experts and the things that we live and breathe every day, be able to contribute to that, to move things forward in a positive, meaningful fashion. And so it was around the sort of the pandemic time where I recognized that there were things inherently in the system that were really going well, but things that I thought I could put my finger on the mark or my finger on the pulse, so to speak, to push it into a direction that I thought would benefit not only clinicians, but patients across Ontario.
Yeah, you talk about the pandemic in your book as well, and that was, sometimes I think like we're like 5 years out from the pandemic, so to speak, and it's sometimes it's amazing how quickly our collective memories have just sort of moved on. But that was an insane period of time, particularly for all of us in healthcare. But what was it about the pandemic that shifted your mindset?
As much as we thought we were prepared for, sort of like a mass situation like we really weren't. I don't think anyone at the time would have predicted just how impactful the pandemic was, like on every aspect of our life. I mean, I'm sure you were the same, where you were asked to close your clinical practice, your operative practice, save for the very, very direst of emergencies. How do we deal with that? How do we create a triage system that would allow us to have that balance between ensuring the right patients are getting the right care at the right time? What does that even mean? Because for us, the right patient at the right time used to mean something, but in the pandemic, those definitions changed. And then at the same time, we were put into positions where we usually weren't familiar. Like I had spent a few days in the intensive care unit supporting some of the sickest patients and our incredible intensive care members that were basically running on empty. And I had the opportunity to really see medicine from a different point of view. And putting that all together, there were systemic things that I thought could change. How do we ensure that our system is robust enough to deal with it today, but also robust enough to deal with it tomorrow? And from that started to spawn some of these leadership ideas that I'm working on today.
Can you talk about some of the challenges that you saw? Because I think that's part of like the sense that I get from reading your book, which we're going to delve into in detail shortly. But the sense that I get from reading your books is that yours was a service leadership kind of calling, in the sense that you were seeing issues in the system that you felt needed to be addressed, and that was sort of your calling. It wasn't that you were someone who was like, oh, at age 25, you're like, oh, I'm going to be the chief of surgery, and the youngest chief of surgery or something. Like that's not the sense that I got. Correct me if I'm wrong, but that's not the sense that I got, is that that's what drew you into leadership. By the sense that I get from reading your books, your book, is that you were drawn because you saw issues in the system.
Yeah, absolutely. I mean, what I saw was an opportunity, and I saw an opportunity. And in the book, I talk about, if not you, then who? I mean, the pandemic was a great example in that we lived the pandemic deeply, right? Each of us felt the pandemic differently. Patients one way, but healthcare practitioners differently. I don't know about you, but living in a dual physician household, it was my wife or myself that were there at every point, at every period of time. And we had to think about, if something happens to us, what are we going to do with our children? Like, that's a powerful statement. Like, what are we going to do about that? Yet when everyone was running away, leaders, nurses, allied health professionals, physicians were running toward, because that's what we were asked to do. And I remember a day coming home, and usually it was, we disinfected in our garage. We left everything there. We put it in a bag and we disinfected it. And we came home, never said hi to the kids, went straight to the washroom. Um, and those were times that I wish that no one has to live again, but we lived through it. The most important thing is, what do we learn from it? Like, what are we going to do today that's going to affect tomorrow based on what we learned yesterday? And I think there was a lot of things that we learned as healthcare professionals from the pandemic, of which I kind of talked about in the book.
So was that around the time, like when did you end up going to Harvard to, because I know you went to Harvard to actually pursue advanced leadership training. Was that sort of after the pandemic and you'd sort of started to get into leadership positions, or was that, did that predate that? I can't actually remember when you actually ended up going to Harvard.
Yeah, it was just after the pandemic. It was about 3 years after the pandemic had started, when we were kind of winded down and we were back to quote unquote normal. And it was at that period of time, I still had a huge clinical, like, that leadership imposter syndrome. Like, I was at meetings, I felt like I could contribute, but there was something that was missing. And it wasn't the skill set that I had, it was that internal feeling, that whisper of doubt that many of us have when we first start these types of conversations. Like, how am I supposed to have a conversation with this individual who is, the lead or the CEO, or running, a health system? But we forget that we've been in training a long period of time. Like, we know this better than anyone else could possibly know. Like, we are experts in our field, whether you're a nurse, whether you're a physiotherapist, a respiratory therapist, a surgeon, we all are masters of our craft. And when I did the Harvard course, that was when I first realized that, you know what, we're all leaders. That was a thesis of the book. We are all leaders. Whether you're that nurse holding the patient's hand in the middle of the night, dealing with an end of life issue, whether you're dealing in a trauma situation in the emergency department, or just dealing with patients in your clinic, we're all leaders in those individual moments. And I think that's what the Harvard course taught me the most.
Yeah, I think one of the beautiful things about the OR in particular is that it's such a little microcosm, right, for the universe outside of ourselves. All these high dramas play out in the four walls of the operating room, and it's just such a condensed, kind of uh, compressed area where all these issues come to light, and particularly leadership, I think, is such an underappreciated skill. And you talk about in the book that surgical training doesn't necessarily make you appreciate that. We have this tremendous appreciation for technical mastery, but I think much less so about the non-technical aspects of the job that we do. Um, do you think that that insight is something that's a result of changing culture, or do you think that's something that has always been there? We just never perhaps made it as clear, or wasn't ever made clear to us that that's such an important aspect of surgery.
Yeah, I mean, I think it's a little bit of both. I mean, I would ask everyone listening, and ask you, is like, look back at your training and identify the mentors that really resonated with you. And if you take a moment to do that, the next question I have is why? It's not because they were excellent surgeons for the most part. I mean, I think almost all, we're very fortunate in Canada to all be trained by world-class institutions. And when we graduate, we're all kind of the same. We're all great surgeons. We're technically comfortable with our craft. But the people that most often that we identify as mentors was not because of the surgical skills in the operating room. It was the soft skills. It was those soft skills that mattered most. For example, for me, it was one of my mentors that resonated with me, that always sat at the side of the bed with the patient, always, held their hand, and always made eye contact at the eye level. And very different than some other surgeons that would stand in a sort of the head of the bed, very, less than ideal bedside manner. Or another situation is how they treated you. Like in the middle of the night when you're up at 3 a.m, we've been there, and it's easy for us to be upset or if something isn't done. But some of the best mentors were the ones that said, you want to take a little break? Why don't we get a coffee? Let's just chat about how you're doing. It's those small moments that have massive impact. But what is that? To me, that was leadership. That was living leadership in those micro moments. And it was those types of events that said to me, that's what I want to do. I want to invest in leadership because those were the most impactful moments in my training. And if we can talk leadership more often, I think not only medicine, but the world will be a better place.
Yeah, I think that was one really core message that resonated for me from the book is this idea again of like finding the little moments, maybe not so little moments, but what we might think are little moments in our lives where we can really exhibit and exude that leadership. And I think that's such a powerful message because it's so easy to get jaded and apathetic and all the things that we find in particularly in healthcare so prevalent is just this global sense that the system it can't change, won't change. There's no point. I find that in particularly in Canada, that's an issue where we just really feel like disempowered. There's bureaucracy. There's with good reason. There's also all sorts of budgetary limitations, restrictions. There's systems in place. There's status quo. All these things that are there that really kind of make us feel disempowered. And I think the core message I took from your book is that there are big or small, there are moments where we can shine. You just have to be looking for them.
Yeah, absolutely. Like there, I use the word, use your leadership telescope. I mean, often for me, I have a love for the cosmos and learning everything I can at any moment about the things that are up there in outer space, to me is just fascinating, truly fascinating. And I said to myself, like, leadership is very different. I use the quote like that leadership is under every obligation to make sense to everyone, meaning that everyone is a leader and everyone should invest in their own leadership. And, the micro moments that you talked about that pass us by every day, whether it's that split moment with your children, whether it's how you interact with a neighbor or a colleague, we think of those as just everyday situations, but really that's leadership micro moments that we should take advantage of, whether that's making a positive impact or positive influence, just an extra time per day. Each of those things are where we are all leaders. And you said something really important at the start that I really want to highlight, that transformation that I call it the dark side transformation in the book, where we start off as this affable, like loving, I'm going to cure the world. And why you want to be in medicine? Well, because I want to change the world. I want to save the world. But when you graduate, you're a different person. And we haven't done enough of why is that change happening? Like, is that a good change? Is it a bad change? Is it expected change? And what are the consequences of that change? And I'm a firm believer that that sort of dark side transformation, while it doesn't happen in everyone, probably it happens in a small component to each of us if we really think about it. And it's probably contributed to burnout and some of the change that each of us are facing, pandemic, yeah, or post-pandemic stressors nonetheless. And it's that sort of that change that each of us faces that I really wish we could take a little bit more of a breath and really dive into why does that happen. It seems to happen a lot in surgical training, but when I talk to my non-surgical colleagues, similar stories are heard.
I got my Yoda right up here, so I really resonated with the dark side analogy. Um, do you think that like your foray into leadership has helped you to kind of pull that back a little bit? That sort of this idea that we can't do anything, that the sort of the quote unquote dark side. Like, what's the interplay? Because my theory about burnout is it's not sheer volume of clinical work or the number of hours you put in. It's a lot of it is, are you enjoying the time that you're spending? And do you feel empowered to do the things that you want to do? Like how have you found your roles in leadership impact sort of the dark side of your life?
Yeah, that's a great question. And I did a lot of soul searching over the past few years on that exact topic. And I think it goes back to the ideas like if you're leading a team, how do you lead a highly successful team? And part of that is being not only just a leader, but making sure that you have a culture of safety, a culture of celebration, all things that can happen if you're still on the dark side spectrum versus the more affable, spectrum that we had talked about. And you have to actively want to push yourself to that former versus the latter. Like you don't want to be dark on the dark side. You want to be that more affable person that we once were. And that allows you to lead and to lead with confidence. Like people, I say jokingly, they don't want to follow, yeah, somebody that's from the dark side. They'll follow, at least not willingly, but they're more likely to follow the more affable version that once existed. So I spent a lot of time doing that level of introspection to figure out how I can not only be a better leader, how I can be a better parent and a better friend, how I can be a better colleague. And that, in the end, I think had significant impact on the teams that I led. We became better and we worked together more, and I think we achieved more.
I mean, we haven't formally talked about the book, but could you talk a little bit about why you decided to write a book? So, what was the impetus around writing a book about leadership? Obviously you're clinically, I'm sure, still reasonably busy. You have all these leadership roles, and then to add on to that, you wrote a book. So, what was the impetus or the drive to write a book about leadership, especially given the fact that there's so many books that are out there on leadership?
Yeah. And talk about like writing leaders to a group of people who are leaders, right? If the thesis of the book were all leaders, and I'm writing a book that I want my colleagues who are, leaders everywhere, like, what's the catch? Why would anyone want to read it? So totally resonates with me. And it started off, I think, in my presidential speech for our society last year, I had given a talk on leadership and some of the ideas that through these other roles that I've tried to spread. And at the end of it, I had an individual come up to me and said, "That would be a great book." And it spawned on me. I was like, yeah, I don't know how to write. I'm certainly not, I've written academic work, but I certainly haven't written a book for the public. So that was pretty daunting. And when it came time to like, what kind of media did I want to produce? It had to be authentic, because that's the type of leader that I always feel is the best type of leader. You have to be authentic. I want people to know what I'm thinking and how I think, because that's the only way that I think the message will resonate. And the only way to do that, I mean, I guess it could be through media like this, through having conversations and open conversations, but the reach is never going to be as significant as a book, because a book is something that, in order for somebody to read it, it's kind of like agreeing to surgery. Like it's something real. Like they put their faith in you by purchasing something and sitting when they have, most people don't have any time. So if they're going to be able to do it, I'm pretty thankful for them to be able to do so. And the way that I wrote the book was to have my voice tell the story, like to be as authentic as possible. The feedback that I received is that I felt like you were talking to me, and that's exactly what I wanted. I wanted to feel like you were in that moment with me when I was telling the story. So then it resonates, but mostly also, it permeates into that sort of deep core of our brain. So the next time you'll be able to use one of those lessons, it becomes easy.
I mean, this is not a podcast about writing per se, but I think it is important for folks who are listening to this, particularly surgeons, surgical residents, who may actually have aspirations or ideas that they would want to put into a book form. And by the way, I couldn't agree with you more about books. Like, this is coming from someone who does podcasts, who's dabbled in that social media space. I think there's something incredible about reading a book because I think, you know, first of all, I think we all could do better with staying away from our phones. Like, there's just no question that's an important thing. I think we should all be striving for. But I think there's an important dialectical process that happens when people read a book, and I think the way that you engage with ideas is very different when you've spent the time engaging with a book. So I think that's brilliant, and it all sort of it makes sense with your whole worldview and what you're trying to say. So I think that's wonderful. But what I was going to get to is this: like, if you could talk a little bit about your writing process. What was the process that you used to write a book? Do you have any advice for surgeons or surgical residents or anyone really who has aspirations or ideas that they would want to put into a book form?
Yeah. And I don't know if my way works for everyone, but I used like a sort of a whiteboarding process where I had the big vision board, and I took time to sort of to write the why. Like, why am I actually doing this? Because as you mentioned earlier, there's leadership books everywhere, right? And to write leadership books, it's really a cohort of the population. But my central thesis was that the current leadership books that I've read or that I've been exposed to are far too academic. And they're meant for those people in the executive suites and the C suites that are already leading teams. But to me, leadership is way more powerful than that. Leadership exists ubiquitously across the system. You know, whether you're a parent, whether you're a colleague, whether you're a friend, whether you're an executive, CEO, doctor, etc., we're all leaders. And that was the central thesis. And so from that, I said to myself that I've been exposed to a very, very small niche of what everyday life looks like for most people, right? Like you and I have spent the vast majority of our life within a hospital, if when you think about it, right? Some of us training toward grade 28, grade 29 equivalents. It's a long time. And so we don't know anything about, you know, finances or like the way that the, you know, different systems around the world, but we do know surgery, we do know medicine. And it's within medicine, there was a lot of rich learnings that I thought that could be applied to everybody. And so that was the central idea. So I used this whiteboarding process to talk about the core tenets of the messages I wanted to get across. And it was interesting because I actually, if the idea is that leadership is for everyone, the thing that I was struck by was two things. Most people don't read books anymore. And even if they wanted to, they just don't have the time. So how is it that I'm able to get my idea that leadership is for everyone to everyone if a lot of people aren't really using, don't have time to read, or if they are, they aren't able to read a 200 or 300 page book. So the feedback I got was take a risk and write a shorter book. Write something that's compact but impactful. And you have to find that balance. So I asked people like, what is that? Is that 100 pages, is it 200 pages, 300 pages? And most people said they wouldn't read a longer book, not because they don't want to, but probably they just don't have the time to invest. So I decided to write a book that was in and around 100 pages. And the idea was very much like surgery, like in surgeons like things that are, you know, concise and compact, the same kind of idea, like surgical precision without the fluff, as I say. So people were able to read it in one setting, understand what I was trying to say, and then use that as a jettison point for other opportunities for them to lead. You're never going to be able to get to be a perfect leader after reading one book. That's just, you know, silly. The idea is that this would be a foundation for that stepping stone to say, yes, I'm a leader. B, I want to introduce myself to more leadership opportunities. And then the final thing is to really identify those opportunities that happen every day where we can make impact.
Can you tell us what your 6 principles for leadership are?
Yeah, absolutely. So I call them lessons because, you know, principles and laws and all the different things that we could talk about have this kind of hubris to them, like you must or you shall. And I don't know if that's the kind of leader that I want to express. As being more authentic. These are lessons. These are the things that in my career as a surgeon and being a healthcare leader, these are the things that I've learned that hold to be true. So the first one was that lesson of the dark side, the idea that all of us, regardless of career path, go through this transformational change from a sort of a young, affable, sort of, I want to cure and help the world. And something happens externally or internally that transitions us to this sort of darker version of itself. And the idea is that the former is likely to lead and lead with impact. And the latter, like being that sort of that less affable, sort of that dark, angry version of yourself is not going to be an impactful leader. So leadership is directly proportional to where you are on that spectrum. And then the second one was the lesson of the silo. And the silo to me is probably one of the most important lessons I think we can learn. And I have many examples within the book, but you know, the idea is that we have been taught incorrectly that there is, like, I'll give you a great example. In every hospital, we're given this sort of organizational chart where there's a top down sort of vertical lines. And that is great for managers, meaning that's the reporting. You report to this person, and it's often related to remuneration or like your contract. You got to work within this. But that is not how innovation works. The real world is much more like an intricate web. We have to break down those silos in order to be able to grow. And I can talk about that a little bit more after. The other one was the law of thyself. We talked about that before, where I said, if not you, then who? And the pandemic was a great example of that. The world needed a strong, calm voice on what to do during these untested times. And it was the nurses, the allied health professionals, the physicians, that made the biggest impact. We did not need the voices of the disinformation opportunists that use their social media platforms. I think I saw somebody put a fork on their shoulder one day saying that if you get the vaccine, a fork sticks to your shoulder, something like that. And I was just like, we need somebody to combat that disinformation. And it was the lesson of thyself, the fact that it was the healthcare system stepping up when we needed it most. Then we talk about the lesson of personal investment. Whether are leaders born or are they made? And my answer always, it's probably a combination of both with an asterisk. Even though all of us are leaders, the ability for us to reach that potential opportunity to be the best leadership version of ourselves requires work, just like surgery. I say in the book, leadership, like surgery, is a practice skill. We have to practice it. We have to fail safely, and we have to be able to learn from what we did to get that leadership street cred to do something better. Then the fifth lesson was the lesson of disruption, which is, I guess, maybe might actually be my favorite because it's sort of a term that I talk about being a polite disruptor. And if there's time, I'll talk a little bit about that. And then the final one is that lesson of celebration, the fact that we need to use celebration as a tactic and as an opportunity to remind everyone about how wonderful they are. And if you put all of these together, and if people were to be better leaders and the lessons that I tried to talk about in the book, I really think we would be in a better place.
It is tough to be a disruptor sometimes, especially in our healthcare system. It just seems like a behemoth, right? So when you say to someone to think of yourself as a polite disruptor, what does that mean? What are some tips about how to be that person that wants to change things, doesn't lose their vigor and their vim for being a disruptor, but can still do it in a way that doesn't alienate people?
Yeah, and that last point, that idea of alienating, is key. I mean, if you look back to those scenarios where you had that certain individual that was a quote unquote disruptor, and if you really think about what they were trying to achieve, they're actually trying to do good. They wanted the system to be better. How they went about doing it was the issue, right? And people stopped listening. And so that's where the idea of polite disruptor comes. You still need to disrupt, but you need to do it in a way that people will not shut you out, but they'll actually open up and listen. And I use the idea that, politeness opens the door and disruption walks us through it. So politeness allows that system to be ready, and then we move forward. And why do we need to do that? Well, I mean, look at surgical robotics, even laparoscopic surgery. When you and I were in our early phases of training, people were like, I do this so well. Why are you making me do something different? It works perfectly. I can get it done like in a few hours. Patients are going home in this many days or this many hours. Why do I need to do something differently? But you needed disruption to allow that innovation to thrive. And one of my mentors talks about this sort of like this 3 areas of surgical effectiveness, these 3 zones. And if I may, I'll talk about these 3 zones and then fit in the polite disruption into there. So like zone 1 is this sort of calm, sort of everyday, almost like our elective schedule. It goes from like 7:45 to 3:30. We've got processes and standards that we follow, and everything goes smoothly. Patients go home, and then we check in and we check out. Like, it's a really nice, calm day. Managers love this area. Managers love processes and systems, and they love the status quo. And that's great. They should, because that allows us to do the business of every day. Now, on the far end of that is zone 3. Zone 3 is chaos. That is like the trauma that comes in the middle of the night. We cannot rely on systems and standards. We just need to do, right? It's kind of like you just need to get the patient to the operating room. Sometimes you don't have time to even do a consent because the patient is so hemodynamically unwell. You just got to do. You don't even have time to do paperwork. You just got to do what you have to do. And it's organized chaos. And that, obviously, anxiety runs high. Even leadership fails in that zone, and certainly managers fail in that zone. And in between is sort of the most beautiful zone, is zone two. That is like where people feel, uncomfortably comfortable or comfortably uncomfortable. And essentially, it's the area where you have some anxiety because you're pushing us away from our comfort zone, but it's not so much to zone three where we feel completely uncomfortable. This is where innovation lives. And you have to be a polite disruptor to move people from zone one into zone two. Not so much that you push them into zone three. It has to be in this sort of this comfortably uncomfortable zone. And a great example is that elective day that gets changed around a little bit. Like look at some of our orthopedic surgeons. They used to do like 4 hips or knees in a day. And then all of a sudden they said, well, let's change this. Let's disrupt the system and let's do this new thing called a swing room, where we can do 2 or 3 rooms running just offset enough that we are able to move from room to room, still maintain those standards and processes that are so important to the work that we do. But now they can do like 14, 15 cases in a day. And when you talk about from a provincial level where, wait lists are X amount of time and we can reduce that to such a significant degree, that's important. Like that's really meaningful. But we wouldn't be able to do there unless we had a polite disruptor, someone that was able to say, we need to break the status quo and then push us into this zone two. Another great example is like robotics. And like I can speak to like cardiac surgery and robotics. Cardiac surgeons literally hold the heart and their life in their hand. And they could do wonderful operations that, that literally were down to each precise movement. And now you tell them, well, instead of doing all of that, we're going to try something new. It just didn't jive. Like, why would we try something new? People are doing pretty well. Why would we do that? And now look where we've become. Because of those initial polite disruptors, innovation thrived, and people are getting surgeries from surgeons in a continent away, like overseas, like really remarkable stuff. And it is that polite disruption that allows us to do that. And so the idea of polite disruption is it is a tool for leaders to be able to break the status quo. And it's the difference between managers and the difference between leaders.
Yeah, no, I'm struck about the idea of the disruptor themselves, right? Like I think, and maybe this comes back to some of the things that we were talking about earlier about how do you maintain yourself as a leader? Because I think what happens for many of us is that we try something and there's just so much inertia or there's so much status quo that people give up. I think like in your study of leadership and your own experience, what's the difference between the folks that can just persevere and keep going and continue to be leaders versus those that kind of just fade away and give up and say, oh, well, this is just too hard.
That's a great question. And I think that that's such a complex question because there's so many levels. Like number one is that sometimes, it's this idea of like the culture that we are surrounded by. Like if you're in a situation where organizational culture is of paramount importance, I think that you see less and less of that burnout of leaders. Often where you see burnout of leaders is that people just get frustrated. Like I'm trying and no one's listening, or I'm trying and I'm not getting any traction, or I'm trying and I'm failing. Like that's typically where we see the burnout. When you see situations where people are that longevity resides, it's usually in situations where we have that supportive organizational culture that allows them to be great and great for over long periods of time. The second thing is sometimes we call leaders leaders, but they're actually managers. And I think if we could just take a minute to talk about the difference, because it's so crucial. Managers, as I was saying before, when we were talking about polite disruption, managers love the status quo. They love system and they love processes. But what is leadership, right? Like leadership is that ability to positively impact or positively inspire people to move the system forward, to break the status quo, to lead with innovation, to do things differently. And so sometimes we call people leaders when they're actually managers. And when managers are in those positions, they aren't allowed to be leaders because the organizational environment doesn't allow them to do that. People want them to keep and to maintain that organization, that org chart structure. They want to maintain the status quo, and they want to maintain process and systems. Yet some of those people get very fatigued because they actually want to step out of the managerial role and become into a leadership role and do more, break the system, and be that polite disruptor. But the system doesn't allow them to do so.
You talked earlier about whether leaders are born or made, and you sort of talked about this idea, probably similar to this idea around surgeons as well too. And are surgeons people who have inherent technical ability, or can it be trained? And again, it's probably a combination of the two. Um, you, I'm curious what your experience at Harvard taught you about leadership, and whether you think seeking out specific additional leadership courses or training is helpful for someone who's thinking about pursuing leadership type positions.
Yeah, Harvard's a special place. Like there's something magical about when you step onto that campus. There's something magical about that place. Like Nobel laureates, like in the hundreds, the inventions and the and the impact on medicine alone that are within the hallways that you walk down are important. I always said to my good friend, the sort of the dean of the Harvard external medical education, David Roberts. I said to him, I was like, you know, what's great about Harvard is that this isn't the place where people read a book and then taught you about leadership. These are the people that wrote the book. And that's a special thing that I don't think many other institutions can say. Now, all that being aside, is that it taught me a lot. It taught me so much more than just the basics. Like, yes, there were things on finance, things that, to be able to actually be in that corporate office and to have, speak like, how do you talk about a budget and the balance book and finances? How do we talk about organizational structure, things that we aren't trained for as surgeons? But what it also taught me was those strategies to be able to be a better leader. Like a great example is don't work out of your emotional basement. As a powerful statement. Don't work out of your emotional basement. It's kind of like, that thing when people say, don't send the email after you read it, sleep on it before you send it, right? But we don't do that enough. Like there are many times where we're reactive to the situation. In other words, we're in our emotional basement, the worst place to make a decision. Take a breath, take that flight of stairs up to the main floor, and then react. And actually, I use that as a parent all the time. I don't know if it's as effective. I think I'd ask my wife and kids about that, but I feel like I'm less in my emotional basement and more in that sort of that main floor of emotions before I try to make a decision, save for a few times, I guess. But the idea is that the tactics were important. And the final thing that I'll say is that, I've done different different medical leadership courses, and they were far too academic, as I was talking about, like the theory of leadership and like, all these different things that I guess would be great in an academic textbook. But when you're there in the middle of the night dealing with a hemodynamically unstable patient or breaking bad news to a patient, or dealing with a child that isn't, doing the things that you want them to do, it's not those academic theories that you're able to pull out. It's the real things that I learned from this course about how do we do the things that we already do. And what was beautiful about it is that it wasn't a one size fits all approach. It was you do what you want to do, but think of these strategies to be able to do the things that you want to do even better.
Yeah, it's like what Mike Tyson said, that everybody has a plan until they get punched in the face.
Yeah.
So yeah, there's a lot of that, if you spend your time reading Harvard Business Review or all these other books, there's a lot of theorizing, perhaps less than the actual practical things that you can use on a day-to-day basis. And I couldn't agree with you more about Harvard. I did my master's there, so it is definitely a special place. Listen, Varun, this has been a wonderful conversation. I've really, really, really enjoyed the chance to chat with you and delve into your book and your thoughts and your thoughts on leadership. One of the questions we ask all of our guests is, if you could go back in time and give yourself advice as perhaps a chief resident or an early attending, knowing what you know now, what would that advice be?
Yeah. I think it is that you were living leadership every day and you probably didn't know it. In other words, that you had that opportunity to make positive impact, whether it's 3 o'clock in the morning, being on call, whether it's after a difficult case or everything in between. And take those moments and run with them. Like identify those moments where you could make a positive impact, make the positive impact, learn from it, and be a better leader moving forward. The final thing that I would say is that I wish I was more attuned to that thing that we talked about right at the start of this, about our mentors. What was it about our mentors that resonated with us? Because leadership needs to be deep and leadership needs to be authentic. If we learn and understand why those mentors resonated with us, what was it that they were doing? Because again, it wasn't their technical skills. It was something that they were doing in the moment that resonated with us. I wish I had more opportunity to sort of to reflect on that. And then maybe I would be a better surgeon than I am today.
You've been listening to Cold Steel, the official podcast of the Canadian Journal of Surgery. If you have comments or questions, please email us at podcast.cjs@gmail.com. Thanks for listening.